guys, sorry to interrupt your video. Just a quick plea, subscribe to my channel please. If you haven't done it already, subscribe. Tell your friends, subscribe. Thanks. Hi guys, the theory test often asks questions about shock. You come round a corner, there's a car crash, you find somebody suffering from shock. But what exactly is shock? So I've done a bit of investigation and I have found this marvellous website over here. So I've been to healthline.com and I've had a look. So I'm just going to start off reading this bit at the beginning here and then go into it a little bit more detail. Let's crack on. So what is shock? The term shock may refer to psychological or physiologic types of shock. Psychologic shock is caused by a traumatic event and is also known as acute stress disorder. This type of shock causes a strong emotional response and may cause physical responses as well. Your body experiences shocks when you don't have enough blood circulating through your system to keep organs and tissues functioning properly. It can be caused by any injury or condition that affects the flow of blood through your body. Shock can lead to multiple organ failure as well as life-threatening complications. There are many types of shock. They fall under 4 categories based on what has affected the flow of blood. The 4 major types are obstructive shock, cardiogenic shock, distributive shock, hypovolemic shock. All forms of shock are life-threatening. If you develop symptoms of shock, get medical help immediately. Here we go. Let's just deal with these. Now remember, this is just high-level stuff. 3 of these are not applicable to the driving test, but you know, as we're on it, I thought I'd have a look at it. So you've got obstructive shock. Let's have a look at the first one. Obstructive shock occurs when blood can't get to where it needs to go. A pulmonary embolism is one condition that may cause an interruption to blood flow. Conditions that can cause a build-up of air or fluid in the chest cavity can also lead to obstructive shock. Fine. So you've got something like a blood clot that is blocking flow. Cardiogenic shock. Damage to your heart can decrease the blood flow to your body, leading to cardiogenic shock. Common causes of cardiogenic shock include damage to your heart muscle, irregular heart rhythm, very slow heart rhythm. Okay, so I suppose heart attacks. Distributive shock. Conditions that cause your blood vessels to lose their tone and can cause distributive shock. When your blood vessels lose their tone, they become so open and floppy that not enough blood pressure supplies your organs. Distributive shock can result in symptoms including flushing, low blood pressure, loss of consciousness. There are a number of types of distributive shock, including anaphylactic shock, so that's a severe allergic reaction. Septic shock, so that's sepsis, known as blood poisoning, can cause that. And you've got neurogenic shock, is caused by damage to your central nervous system, usually a spinal cord injury. Hypovolemic shock. Now this is the one that they're talking about regarding the driving test and the theory test questions. Okay. Hypovolemic shock happens when there isn't enough blood in your blood vessels to carry oxygen to your organs. This can be caused by severe blood loss, for example, from injuries. Right, so here's a hemorrhagic shock part 4 that I dug up earlier on. So what is hemorrhagic shock? Hemorrhagic shock occurs when the body begins to shut down due to large amounts of blood loss. People suffering injuries that involve heavy bleeding may go into hemorrhagic shock if the bleeding isn't stopped immediately. And this is what they're talking about on the theory test questions. You find somebody suffering from shock, what do we check for? And it's always look for deep cuts, missing head, you know, stuff like that. So we've got common causes of hemorrhagic shock include severe burns, deep cuts, gunshot wounds, trauma and amputations, which of course is a very deep cut. So according to these guys, hemorrhagic shock is the second leading cause of death in people with traumatic injuries. Okay, hemorrhagic shock is one of many kinds of medical shock which are different from emotional shocks. Right, so it's basically heavy bleeding and signs of hemorrhagic shock. Right, so all symptoms of shock are life-threatening and should be treated as a medical emergency. Symptoms of hemorrhagic shock may not appear immediately. Right, so they include anxiety. Not entirely surprising. You've been in a car crash, you're missing an arm, you're going to be anxious. This is why they always say you've got to calm people down. Blue lips and fingernails. Well, if you're losing blood, then the blood can't get to your extremities, and therefore you're going to have pale skin. You're going to not have any colour. Low urine output, fine. Profuse excessive sweating, fine. It goes along with the shallow breathing because you're going to be hyperventilated. You're going to be, all your body's going mental, so you're going to be sweating. You've got shallow breathing. Dizziness. Well, if you're losing blood, it's not going to your brain. Confusion, again, same as before. Chest pain, not entirely surprising. Your heart's going bananas at this point. Loss of consciousness, well, yeah, because you know, if you don't get any blood to your brain, you're going over, aren't you? Low blood pressure, right, and rapid heart rate and a weak pulse, right. So these things here, we're thinking, well, what? Now, if you think about it, if you are losing blood out of your system, then your heart is going to work overtime to try and rebuild the pressure in the system. So your heart is going to be going bananas. So you've got a rapid heart rate, but you have low blood pressure, which means you have a weak pulse, because if there's no blood in the system, you can't increase the pressure. All right. Of course, bleeding externally is going to be obvious, but you might have internal bleeding as well, which is hard to identify. But this is basically what we're looking for, and these are the things that the theory test is going on about. All right, so hopefully that makes sense to you. When they're talking about shock, they're talking about you've been in a car crash, you've got bleeding, you've got low blood pressure, therefore you're going to get all of these symptoms potentially. That's what you need to be thinking about when you're answering your theory test questions. Okay, so I hope that helps. Thanks very much.